Hi there. Today we're going to discuss a novel way to stretch the iliotibial band. This is for patients with tighter than normal iliotibial bands or limited in hip adduction or some sort of bursitis of the hip. The way we do this, and I call this the cross under stretch, which is a little counterintuitive to the traditional way where you're lifting up and over the non-stretch leg. So Itai, if you can you bring this leg over like this? And what this does is it keeps his pelvis level, keeps his hips backwards too. Now the idea behind this is that the iliotibial band, which crosses over the greater trochanter in its most lateral position, and stretches it all the way to its insertion at Gerdy's tubercle. So what we do now is, depending on how far the patient can tolerate it, we literally are now just sliding it into adduction, and you're going to notice that Itai wants to either go one way or the other. And that's because as his IT band gets tight, it wants to force its way to the least tension, which is snapping off of the greater trochanter. And he could do that by externally rotating or internally rotating. So it is important that we keep the foot at sort of 12 o'clock or straight up, and we go as far as we can without bending the knee and without lifting one way or the other. Now I like to try and do it just enough distance away from the edge of a table, a bed, etc., so the leg could be anchored on the edge and he could keep his foot in that 12 o'clock position. Whether we have to put something under here or whether it just is able to stay in this position by being locked. In doing so, we are sort of trapping the iliotibial band directly over the greater trochanter, therefore creating the longest path from its origin to its insertion. So sort of point A to point B, over here it was shorter, and all the way across it has to travel further over the greater trochanter. This is a great way and a very easy way to self-stretch. Now, as with most stretches, certainly of non-contractile structures, it takes a little time to get the deformation, the plastic deformation or the creep, if you will, of the inert structures. So I like to have the patient, as long as they're not having any back pain or any medial knee pain, I like them to hold this stretch for somewhere between 3 and 5 minutes. I like to do it 2 to 3 times a day. Easiest if they do it in the morning coming out of bed and in the evening going back into bed. I find that's just a nice schedule. So once again, this is the cross under stretch underneath the non-stretched leg, holding for 3 to 5 minutes and locking it to the opposite side of the bed. Thank you.